Exclusion from Social Life Course and Gender Considerations for Policy. And today we're presenting findings from the GenderNet plus GenPath study. So this is a study that was conducted across 7 countries, and we were presenting on some of the component of the work that was completed in Ireland. So we were just giving some additional minutes for some people to join us there. And now that I can see that we have our full complement, we're going to commence away. So today's session will follow a general structure, but we also hope to have some good time for discussion and for some questions and answers as well. We hope to give yourselves maybe about 50-minute duration for this session overall. So we'll begin by just introducing the overall study. So I'm just going to introduce you to the cross-national design and to some elements of the policy context as well. And then we're going to focus on the Irish GenPaths component. So I'm going to invite Celia Sheridan, who will do this presentation and talk to you a little bit about the rationale and methods for this specific component, and also talk to you and take you through the research findings that came out of this component of work as well. Celia will then look at some of the key conclusions and present some of the key recommendations that are coming from this work. And then at the end, as I said, hopefully we'll have time for some questions and answers. So by way of a broad introduction, I think it's first important to define what do we mean by exclusion from social relations. And ultimately, we're taking a slightly broader approach here. And it's an approach that we are increasingly seeing within the literature itself. So we describe exclusion from social relations as a situation in which people are socially and emotionally disconnected from adequate levels of intimate relationships, social networks, social support, and or social opportunities. So as you can see, it's very much a multidimensional view of relational dynamics in later life, and very much also focuses on these kind of dynamics across those different facets of relationships as well. The other piece that's implicit within this is that we're interested in a life course perspective. So I suppose unlike the traditional view of isolation or loneliness, here we're essentially looking at those components of the relationships that can give rise to outcomes in terms of isolation or loneliness or other health and well-being outcomes as well. Okay. So then in the context of what we're going to present today, it is situated in this broader cross-national study. So just to give you a little bit of insight into that, this study was completed across 7 countries. So that's Austria, Czechia, Ireland, of course, Israel, Norway, Sweden, and Spain. And the key kind of aim here was to really explore a life course perspective and to advance a life course perspective on the gendered pathways of social exclusion in later life and to examine its consequences for health and well-being. So this is a mixed method study, even though we're only going to be presenting on the Irish component, which is really around the qualitative aspect. There was certainly a quantitative secondary data analysis piece, which looked at the data from survey of health and retirement in Europe. The unfortunate side of that is that there isn't any Irish data within SHARE, but ultimately the idea here was to examine a cross-country kind of perspective in terms of the countries that contribute into that data set around life course risk factors, around health and well-being outcomes, and to also examine the sort of patterns of exclusion from social relations more broadly. The second component then, which is feeding into the work that we'll be speaking to today about, is the qualitative data collection, where there was essentially 210 qualitative interviews with older men and women conducted across these 7 countries. So from this project, if you visit this website here that's listed on the presentation, and we can also maybe put it into the chat function as well, you can see all the publications and outputs that have arisen from there. So in all, I think currently we're up to 7 cross-national peer review articles. There are various different national policy seminars, And I suppose a key element here, even in the context of Ireland, is to keep an eye on these websites, because more and more articles are coming out as we go through. So the project itself has ended, but certainly the dissemination will be continuing on. So GenPat was a part of the GenderNet Plus EraNet co-fund project, which had a contribution to the Irish Research Council, and which was managed in the context of Ireland from the Irish Research Council as well. Okay, so that is, I suppose, the broad setting for the actual research design and research study. So I'm going to just maybe briefly say something about the policy context from which Celia is essentially going to be presenting her work. And I suppose when we think about social relations in later life, particularly in Ireland, we certainly realize the importance of those relationships. We certainly emphasize that importance in terms of policy and practice and discuss it widely. We also have expressed significant concern, both as a society and as people who work professionally in research, in practice, or across policy domains, for the social relations in later life. And I suppose in some ways we can see that recognition and see that importance across some of our key kind of policy documents. So we have the National Positive Aging Strategy, which talks about the recognition of the importance of social and community lives of older people in general. It talks about the need to combat isolation and particularly combat loneliness with respect to later life. But I suppose in one aspect, it doesn't really focus in on specific details around pathways that need to be addressed. And specifically as well, doesn't perhaps think about the heterogeneity of the older population with respect to gender or other diversity aspects as well. And again, to some extent, you wouldn't necessarily expect it to, but certainly the focus isn't there. The other aspect that we would think about when we're looking at social exclusion is we would think about the national action plans for exclusion and inclusion in Ireland and across other European countries. So in committing to combating poverty first and then later exclusion, Ireland signed up with other member states to monitor and to address social exclusion. And this includes in terms of particular at-risk groups, and certainly older people would have been identified as that group. So again, within the latest document around the roadmap for social inclusion, focusing on 2020 to 2025, there was a commitment to tackle loneliness and isolation. But a lot of that focus really was on other areas of later life as well, such as incomes for older people and with respect to access to services within the community as well. So outside of these kind of main policy areas, there are a number of developments that are really important that certainly provide us with the potential to maybe address exclusion from social relations. And not least amongst these is the age-friendly programs and the development of age-friendly programs nationally. And certainly Ireland being the first of the country, age-friendly country globally, we are in a good position to try and do that. And certainly there's a lot of advantages with age-friendly programs in terms of that sort of integrated frame, the sort of calling out of key aspects around isolation, around inclusion. But certainly at an international level, some programs have been critiqued for not perhaps focusing specifically on social relations to the degree that perhaps would be warranted given the weight in people's lives. So again, this is more of a question of potential rather than an issue or a challenge, but it's something there that we could maybe expand and build on. And the last element to mention is the Task Force for Loneliness, which was set up in Ireland, and that task force is obviously continuing to do its work. So these aren't exactly policy developments, but there are elements that might be able to mobilize policy change and affect positive change into the future as well. Okay. So before I introduce Celia and before we move on to the presentation, the main findings, I should say that what Celia is going to present today will be contained within a policy brief that is now being released on our own website, and you can see that link there. And again, we'll put that link into the chat function for you as well. So this policy brief is essentially presenting the rationale of this component of the work, which focuses on the qualitative interviews with older people in Ireland, and draws out those key thematic areas that Celia will speak to you about and presents the recommendations which Celia will speak to you about as well. So with that, I'm going to introduce you to Celia Sheridan, who is a member of the research team here in the Irish Centre for Social Gerontology. Celia was also completing her PhD on this work. And so, Celia, I'll hand it over to you.
Thanks, Kieran. As Kieran mentioned, I'm Celia, a researcher on this project, and I've also been completing my PhD on this project in conjunction with Kieran and Dr. Amy, Anya Neely Amy. So I'm here to present the findings from our research on exclusion from social relations, looking at life course and gender considerations for policy. So the next slide, please, Kieran. Okay, so these are some of the reasons why this topic is important, and there are a number of key points for the rationale. The first is that exclusion from social relations can have significant implications for the daily lives of older men and women, and for their broader sense of identity, health, and well-being. And the second point is that these relations can be influenced and impacted by life course experiences and events, such as bereavement. And these can often act as turning points in relation to levels of social connectivity, and can sometimes lead to depleted social resources, such as reduced social and support networks and poor quality relationships. They can also lead to other exclusionary outcomes, such as loneliness, isolation, and also negative mental and physical health. And third point is that men and women do tend to have different life course trajectories, which mean they can experience exclusion from social relations at different stages of the life course, with differential outcomes, particularly in later life. Next slide. Thanks, Kieran. Okay, so despite all of this, we actually do have a lack of knowledge around gender, age, and exclusion from social relations, particularly in relation to how different life experiences of older men and women may generate exclusionary outcomes or impact the timing of these exclusions. So the implications of us not having sufficient knowledge is around our capacity to identify and reduce this form of exclusion in later life, but it also means that the design of interventions may not be as impactful or relevant for either older men or women. And it also has consequences for our capacity to tackle the complex social challenges, which Kieran mentioned in his introduction, such as loneliness and isolation in later life, particularly in an increasingly aging Irish population. And finally, I think it's worth mentioning that the COVID-19 pandemic has re-emphasized the importance of social relations, and it has shown how these relations can be disrupted and impacted, especially for older people. And I think it's also illustrated the importance in addressing this topic within policy and practice. So the aim really today is to what the seminar is actually about. And as Kieran mentioned, it is based on research to examine the influence of gender and gendered life course experiences on exclusion from social relations in later life and the implications for policy. And next slide, please. Thanks, Kieran. So first, I'm just going to briefly go through some of the existing evidence that is out there that allows us to kind of think about the way gender might be an issue for exclusion from social relations. Then I'm going to look at the methodology that we employed for the research, and then talk about the findings and take you through some of our concluding remarks before then giving some time over to the recommendations. So we found three cross-cutting themes within the literature on how gender might construct exclusion from social relations for older men and women. And that first one is around gender inequality, which can manifest itself in various forms and can be experienced over the life course, both shaping and impacting relational development for men and women. And this is particularly evident in terms of the inequality of economic power and material resources. And given their occupational roles in society, men are more likely to enter later life with these resources, which can create social opportunities in different ways for men. But these opportunities aren't necessarily available to women. However, in some cases, this inequality can give rise to resilience over the life course for some women, whereby they can develop what would be called survival strategies. And next slide, please, Kieran. Thank you. And so the second theme that we found is around gender norms and roles, and these can impact on an individual's capacity to build social ties at different stages of the life course, with fluctuating gender patterns in social relations across time. And there is evidence to suggest that women, particularly those who had an ongoing role within their household over the life course, can sometimes experience greater continuity in social relations in later life, more so than men. Whereas in contrast to this, the workplace can be a primary source of social connectivity for men, but however, they can experience a decline in friendships after retirement, and there seems to be little evidence of them expanding their social network post-retirement. So as a result of this, some men can become more reliant on their spouse or partner after retirement, which would put them at a greater risk of exclusion from social relations where the death of their spouse might occur. Also, these gender roles and norms tend to influence later life repartnering, with men more likely to repartner than women. And this also relates to gender identity, which is the third dimension that I want to mention here. So gender identity constructions can influence relational trajectories. And this again relates to the social opportunities and challenges regarding work, employment, and caregiving that I've just mentioned. But it also relates to decisions regarding intimate relationships, for example, where being married can be especially important for older men. It not only provides a sense of belonging, but it's an opportunity to practice and maintain their masculine roles and identities. And also, gender identities have been shown to influence decisions regarding social participation and appropriate spheres of social engagement. And indeed, some research has found that male gender identity was a barrier to men participating in local club activities, with the lack of participation driven by their perception that these activities were deemed to be too feminine. So just before I go on to the methodology, we found that research in this area shows some mixed results. And obviously this creates some of the ambiguity around social relations and exclusion, which again is another reason for researching this topic. So now I'll just run through our methodology. We adopted a qualitative exploratory approach to conducting this study, and one that was really around capturing the lived experience of the social relations of older men and women. We took a life course perspective to the research, and by doing so, we considered factors such as institutional, structural, and normative influences when conducting the interviews and doing our analysis. We were also interested in key life events or turning points that the participants may have experienced and that might have had an impact on their social connectivity. So we carried out a total of 30 telephone interviews between September 2020 and April 2021 with men and women aged 65 and over. We recruited these through purposive sampling facilitated by community and sector gatekeepers. We interviewed 17 men and 13 women with an average age of 75. And within this sample, 5 were married, 9 widowed, 6 divorced or separated, and 10 were single, never married. Out of the 30 that we interviewed, 21 lived alone, and 11 lived in a rural setting, and 19 in an urban environment. So the interviews themselves were divided into 3 parts. We had an open narrative question, which probed the participants' daily routines and what social opportunities that might be available to them on a daily basis. The semi-structured section focused on topics such as social network formation, barriers to social participation, their experience of loneliness, key life events, and health and well-being. Now, for the third part of the interview, we use the social convoy model to map the social relations of the participants. And this is a tool that was developed to describe changes to an individual's social network over the life course. And it helps to capture details such as relationship quality and frequency of contact. And the idea is that a person's convoy travels with them through their life. But it is influenced by factors such as situational, life course, and personal characteristics, such as roles and norms, gender, and age. So we completed this by asking the participants to give the names of those people who they feel the closest to within the inner circle, those who they may not feel as close to, but are still important, to be placed in the middle circle, and the outer were for those people whom they felt close enough to and important enough to be included in the circle. And in doing so, we also probed on who they felt the closest to out of the names they provided and who they could trust with sensitive issues. So just finally on the analysis, all interviews were audio recorded, transcribed, and analysed with the aid of in vivo qualitative software. The analysis of the data was based on constructivist grounded theory. This is an inductive approach to analysis with no pre-existing frameworks or theories, and it involved an initial coding of all 30 interviews, which was done line by line, and then a more focused coding where categories were developed, and then a thematic analysis was carried out. And additionally, to provide further context to the interviews with the older participants, interviews were also conducted with 9 stakeholders who work with or represent older people. These interviews explored topics such as the stakeholders' understanding of exclusion from social relations, factors that might contribute to this form of exclusion, and also the policy and practice guidelines that they might refer to in their work to support older people. Okay, so now on to our findings. So we identified 4 cross-cutting factors as contributing to exclusion from social relations for older men and women over the life course and in later life. And these were bereavement, relocation and work-life trajectories, relational disruption, and health and well-being. I'm going to go through each one separately, starting with bereavement. Okay, so bereavement was a feature across the lives of all 30 participants, with some experiencing an accumulation of losses over their life course. And this included loss of siblings and children, but it really was the loss of a spouse that dominated the accounts of the participants, and that was described as significantly impacting on their social relations. 9 of the participants experienced this form of bereavement, that is the loss of a spouse. We had 6 females and 3 male participants. So some of the negative impacts of bereavement on the relational lives of those participants included the loss, obviously, of their companion, loss of connection to wider networks, and in some cases, a lack of motivation to re-engage after this loss. There was evidence of gender differences in the experience of bereavement and in the coping strategies used to alleviate its impact. So, for example, the female participants were more likely to describe joining a social group to alleviate their loneliness, or are more likely to seek counselling from a bereavement support group. Also, they were more likely to describe their feelings of loneliness, with some vividly describing the need to join something after their husbands died. And those who did join a group typically experienced a widening of their social network and opportunities. And this enabled, for some of them at least, the development of new friendships in later life. However, sorry, Kieran, next slide. However, regardless of gender differences, a number of participants talked about the difficulty of adjusting to new living arrangements, and also, as Ella describes here, also the loss of emotional support. And he also talks about the length of time it took to adjust. So he says widowhood is difficult. It was difficult living on my own, missing my wife, you know, a soulmate, if you like. you found that would be difficult. And I could feel after a while you were kind of accepting it, accepting it, and just kind of, it takes quite a number of years, I think maybe 12 years. So also, furthermore, we found that the restrictions and expectations around widowhood as a result of societal and gender norms were more likely to impact women, as this quote from Joan shows. So she said, she's a widow, obviously. So I used to meet these two guys out walking, one of them whom lives down the road. We would chat and sort out the problems of the world. And talking to one of them in particular, we often talked about food. He loved going out for eating. And subsequently, his wife died. But there was no way spontaneously that I could say to that man, look, I know you like eating out, so do I. Why don't we go out and eat out together? There's no way socially I would do that. Okay, so now we're on to our second theme. This is relocation and work-life trajectories. And these were interconnected themes and emerged as having different influences on exclusion and social relations in later life, with different work-life trajectories being described by the male and female participants. So most of the female participants experience an interrupted working life, with some given up work entirely due to their caring responsibilities. Also, given the prominence of the male breadwinner model, a number of the female participants spoke about how their husbands' working life both superseded their own career goals and resulted in relocation. Also, in some instances, cultural and gender norms meant that women resigned their employment positions and relocated due to marriage. For some male participants, in particular, there was an emphasis on how workplaces can act as an enabler of social relations, and they often described accumulating social networks over time, but some also described a depletion of these networks on retirement, and we'll see that in an example later on. So here Patricia describes leaving her job to return to her hometown, moving to her husband's farm after marriage and feeling disconnected from those around her. So I think this quote highlights the disruptive nature of this type of relocation for social relationships and in general, and the capacity in the long term to build connections to local communities. So she said, I was living away in a flat, and I was living in the city. But when I came back after marriage, I never had time to make friends, really. I was from the area, I had no bother settling into it, but I had no friends. I missed my friends terrible, but I never said it, but I knew I was missing them. I was living on a farm. My husband was a farmer, but I was trying to make do. I felt left out because you didn't sort of fit in. So in some other cases, some of the female participants, again, described a history of residential relocation, which was linked to the employment and work-life trajectories of their husbands. This impacted on their ability to, again, become embedded within the community or to make long-term friendships, as Carmel talks about here. So she says, when I got married, we actually lived in 5 different counties because of my husband's work. So we moved around. Making new friends was difficult. It wasn't too bad when the children were small, because very often you made connections through the parents of their friends. But I found the move to place was probably the most difficult, because the children were much older at that stage, and that was difficult. So I think I mentioned earlier that for some of the male participants, work was a source of social connections for them. But some spoke about the loss or depletion of these connections after retirement. And this was particularly more acute for the participants who had relocated several times for work purposes, and as a result had not really embedded within their community, as Peter describes here. So he said that I lost most of those work colleagues. I lost virtually all of those people when I retired. And the interesting thing was that none of them lived near me. 1 or 2 lived across the city on the other side. Some of the others lived in a place. I was based there with the organization for 6 years. So some of my good work colleagues lived there, and I've lost touch with all of those. So I don't see them, but there's nobody. I have nobody that I can actually go out the door and call on. I don't. So this is the third theme, relational disruption, and drivers of this type of disruption were diverse across the participant sample, and it included changes in respect of relocation, work, and retirement, which I've just talked about in the previous slides. But it also related to the nature of interpersonal relationships themselves and the ways in which issues regarding conflict, abuse, and even domestic violence can impact on social connectedness in later life. So some of the sources of conflict were primarily linked to sibling and intergenerational disagreements. And this was predominantly an issue for the male participants and was experienced at different stages of the life course with different degrees of severity. However, for some other participants, the relational disruption they experienced was more severe in its consequences, and a small number spoke about the physical and emotional abuse within the family home in early life and or abuse within relationships with partners in adulthood and into later life. These experiences were predominantly relayed by the female participants and were described as having a clear impact on their capacity to develop healthy, intimate, and social relationships. So in terms of conflict, sorry, Kieran, next slide, please. Thank you. So in terms of conflict, as Michael describes here, the impact and legacy of intergenerational conflicts can lead to a depleted social and support network and also to missed social opportunities over the life course. So he said that the relationship with one of his sons has difficulties for a long time. So we wouldn't see as much of him as we would see the other two if they were living in Ireland. He was just causing hassle, hassle, hassle. It's a pity because I'm big into Gaelic football. He's huge into Gaelic football, and we could have been so close. We do see more of him now, but there probably still a little reluctance on my behalf to totally get in with him as much. And in terms of abuse, the long-term impact of an abusive relationship is described here by Fiona. She had become socially and relationally disconnected from her friends during her abusive marriage and has become somewhat apathetic about establishing new relationships in later life, despite missing some aspects of a couple relationship. Fiona said, I might get the feeling now and again, wouldn't it be lovely just to go out for dinner with somebody or go dancing, things like that, really. Not that I wanted another relationship, I certainly didn't, but I mean, little things like that. And sometimes I am now one alone. I went to my son's wedding on my own, and the other weddings I have been to, I've been on my own. I'm learning to cope. So now on to the final theme, that's the fourth theme of our findings, health and well-being. So the health trajectories of the participants varied, but the majority experienced some form of ill health or disability at different stages of the life course, impacting to different extents on their ability to participate socially in later life. And while the both male and female participants were affected in similar ways, there were some gendered patterns that had emerged, mainly around recreational choices and physical demanding jobs, which had an impact on their social relations. And also, many of the participants were cognizant of the age-related health changes that they were encountering as they got older, which often signaled a permanent shift in their health status and on their physical ability to participate socially. And this is described in the next slide by Teresa. So these age-related health changes for some of the participants meant they were no longer able to drive, for example. Some chose not to drive, which limited their social participation. And Teresa here is one of the participants who decided to give up her car. Now, I used to have a car, but I don't drive anymore. I gave my car to my niece. So the only way I would travel would be like I'd have to get a taxi there and a taxi back. And this was to visit a friend of hers. I don't like traveling at night, to be honest. I've kind of got used to staying in. I'm not bothered about going out now. So as I mentioned in the previous slide, there is evidence that some social and recreational life choices earlier in life had health consequences in later life, with some gender patterns emerging, such as going to the pub to socialize. So here Tom describes how having to reduce this form of social participation due to health issues, combined with the lack of social opportunities for his age group, which limited his social interactions. So he said, I used to go to the pub occasionally one time, but I stopped. I stopped drinking about 4 or 5 years ago because I had an operation for a gallbladder. I hardly ever drank anything after that. I used to get to know people around when I used to go to the pub, and I used to meet them, and I got to know quite an awful lot, a good few people. I still meet a few of them when I'm out walking. At my age, what could I do except maybe go to the pub? And I don't like drink anymore. So in terms of physically demanding labouring occupations, some men talked about having to give up their roles due to physical injuries. And in some cases, as Danny explains here, this restricted mobility impacted on social interactions within their local communities. So Danny said, I've got a dodgy knee. I used to be a floor layer and we never used knee pads protection, and you always favour one knee. So this is a knee that's affected. So not any transport and finding a drudge to walk anywhere. Shops are too far to walk. The public transport has never been great. I've got to walk to the bus stop, which is the same distance to the nearest shops, which I can't do. And then I've got to stand waiting for the bus, which puts pressure on my knee. So just before I get to the conclusion, I just wanted to mention that even these 4 themes haven't really addressed the full diversity of our sample or other forms of intersectionality. So for instance, we had some participants who were members of the LGBTQ plus community, and there, I think there were certain nuances across these themes, but also certain specific themes that are more related to their lives and experiences that would need to be considered. So for example, the process of coming out as gay to a spouse leading to divorce, which can have significant implications for the social relations of both parties. But there were also more specific experiences that were detrimental to a participant's trust within their relationships, which again significantly impacted on the participant's social relations over the life course and into his later life. So now on to the conclusion. So this seminar explored the social relations of men and women and the influence of gender across the life course and in later life. 4 factors were identified as having the most impact on the social relations of older men and women. And these factors represented life course experiences and key life events. And just as a reminder, these were bereavement, relocation and work-life trajectories, relational disruption, and health and well-being. But I think independent of gender considerations, there is a growing body of research that documents the impact of these experiences and events on relational connectedness for older people. However, while the intersection of age, gender, and exclusion from social relations remains underexplored in the literature, gender differences and gender pathways to exclusion were evident in our findings, and they are broadly in line with the international literature on this topic. So next slide, please, Kieran. So while there was sufficient evidence to suggest that either being an older man or an older woman was in comparative terms more associated with a higher risk of exclusion from social relations, within the life experience and events discussed here today, it was clear that there were gender-based vulnerabilities were operational for some of the participants within their past and within their present relational lives. And at times, these vulnerabilities function to constrain their capacity for more inclusive and connected sets of relations in older age. And sometimes these constraints were normative social limitations, such as expected and accepted roles, and sometimes they were informed by the participants' own personal attitudes towards relations, such as which activities not to engage in or to participate in. But however, in the same way, there was also some evidence of gender-based advantages, particularly including work-related social capital, which was linked to some of the male participants' working lives, and then for the women, it was more to do with the community level connectedness that they would have accumulated over their life course. So I think it's also worth noting here that these findings are likely to be cohort specific, and over time the dynamics between gender, age and exclusion of social relations is likely to shift. But ultimately what this research points to is a need for a more gender sensitive understanding of exclusion from social relations, one that considers the temporal and life course development of risks and advantages for the older men and women. And it is in this respect that the lack of meaningful policy and practice developments in this field is particularly evident. And while current policy supports older people and inclusive communities, there is little detail on the sort of pathways that need to be addressed to prevent outcomes of exclusion from social relations, and little in the way of specific resource allocation to implement necessary interventions and circumvent these pathways. So more concentrated, comprehensive and coordinated efforts are required to move beyond the social and political rhetoric of concern for social connectedness in later life to an agenda and programme that measures, supports and advances social connectedness for older people and women in later life. So now I'm going to, on this basis, I'm going to talk about our recommendations. So in terms of the first three recommendations, what we concentrate on here is the broad issues that need to be addressed. So for the first recommendation, we have suggested that social relations in later life needs to be recognised and established as a central public policy focus in Ireland, with a defined agenda required to address the implications of exclusion from these relations. The second recommendation is that gender must be an explicit consideration within policy and practice that is focused on social relations in later life, where attention must be given to both gender differences in outcomes and gendered exclusionary pathways. And the third, more broad recommendation is to co-produce and roll out a public awareness campaign on exclusion from social relations in later life that is informed by and sensitive to the life course experiences of older men and women. So the next set of recommendations are really based around the thematic areas that have arisen from our findings. So for instance, in terms of bereavement, we have recommended that there needs to be concentrated efforts to address relational impacts linked to bereavement in later life, and to acknowledge and address the differential impacts of the loss of a significant other on relational connectedness. And also, there remains a significant need to provide and promote local bereavement support services for older adults, with particular focus on encouraging older men to engage with these services after bereavement, and or to connect them with local voluntary and community organisations. So in terms of relocation and the work-life trajectories, we will recommend that the design and implement gender-sensitive interventions to target women who may be at risk of life course exclusions from social relations due to relocation, and to target men, encouraging them to develop community relationships. And also build an awareness of the risk of exclusion from social relations post-retirement, and develop support programs for retirees, such as, for example, community connection hubs. So on to the third theme that we had in our findings for relational disruption. We would recommend a focus needs to be placed on developing and broadening reconciliation and mediation services to people who experience conflict within their relationships, and address issues around redeveloping and or enhancing awareness of adult safeguarding services and wraparound services, including those concerned with relational outcomes. And on to the final two recommendations, which are around health and well-being. So first, we recommend addressing environmental factors that restrict social participation by ensuring infrastructure such as accessible social spaces, transportation, etc., sufficiently meets the needs of older people in line with social inclusion and age-friendly agendas. And finally, to recognise the spectrum of age-related capabilities and mobility and the right to participate socially, while building an awareness of the gendered nature of riskier health behaviours and the impact on social opportunities in later life. And that is the end of my presentation, and thank you, and I'll hand you back to Kieran.
Okay, thanks very much, Celia, and thanks for moving through that in a very, very concise and efficient way. So that is the core of the findings and the recommendations. As you can see, many of those recommendations are, I would say, perhaps long-standing in the context of Ireland and long-standing in terms of what's needed around people's relationships. And I'm sure there are many others that could be more specific and more nuanced as well with respect to subgroups of the older population. So I think ultimately the benefit of this is that it is coming from people's lived experience, and it is coming from people's perspectives that, and we probably didn't go into this in too much detail, that also was tracked during a period of both COVID-19, but also so both lockdown and also the periods that weren't in lockdown, but also was supported with repeated interviews afterwards as well. So there's a little bit of a longitudinal element there that we can rest some of these recommendations on too. So we have some time for questions. So I would invite you to put those questions into the Q&A comment box, if you just see it in the bottom of your screen as you're looking at the Zoom folder. And then on top of that, we've got a number of questions in already. So we will take a few of these if we can. So the first one is so this is from someone here who's asking about, was there any other risk categories other than gender which increase susceptibility of exclusion from social relations? So Celia, I might hand that to you.
Thanks, Kieran. Yeah, I suppose if we took out gender, I think all of these themes, would be risk factors. Bereavement in itself is a risk factor. I mean, I touched on disability. We had quite a few participants who had a disability over their life course or in later life, and they certainly had issues with social participation and exclusion from social relations. So I think, disability and health, and again, taking out gender out of the relocation, I think all of those in their own right would be categorized as contributing to the exclusion from social relations.
Okay, and I suppose in terms of that as well, I guess one of the things that are there is in terms of people's residential life course trajectories, which obviously there is embedded in things, but people coming into different places at different points in their lives, and it really depends on when they make those moves and where those connections are as well. I guess what we haven't touched on so much is around material resources, and I think that didn't probably emerge too strongly, which might be an element of the sampling, but also I think it shows that it's somewhat regarded as being not so much independent, but not necessarily the key driver for people's relation networks. Is about the opportunities and the context that people have within their immediate and local areas. Okay, so another question then, just in terms of, so one here from Oliver, is there evidence that social exclusion is less evident for people involved in social, cultural, sporting and community organizations? So Celia, I might get you a chance of that one.
Okay. We had a few participants who they weren't involved necessarily in these organizations, but they found it hard to attend events, and this was probably primarily due to their health, and the mobility issues. So I think in that respect, some of them missed being able to attend, with say, football matches, and things like that. But generally, there wasn't so much, I guess, of that within the data. It was more attending these events, and which was difficult for some of them. Is that kind of what?
No, I think so, but I think the other aspect is that sometimes, maybe again, just from the data, it seemed that sometimes this was somewhat independent. So I think even in terms of recruitment, and see, if you remember, we were discussing this, that sometimes the recruitment were through some organizations, and you would automatically assume that people were somewhat connected once they were embedded within these organizations. And actually, in a lot of cases, the people who were in these organizations were motivated to join them because of issues around relational connectedness, and perhaps still felt those issues. So it's somewhat difficult to pull out that pattern as a kind of a conclusive element as well. A second aspect is, so there's Neve is just asking here, do we find it difficult in recruiting participants? We often find it difficult to find older persons who are willing to open up about their experience due to, sorry, the question has just disappeared on me, due to, I imagine, feelings of privacy and anonymity, and maybe a bit of a sensitive issue. So I think, Celia, do you want to comment on that one there?
Yeah, now the question is gone as well for me, but yeah, well, we didn't, I guess we found it, I think, quite easy in the end, to recruit, and we had very good gatekeepers, which helped us. So I was able to find the 30 participants, I think, we it took a while, but we were very lucky to have had the 30 participants. And about opening up, I think, yeah, some were a little more reluctant, but maybe because we did telephone interviews. I had really good interviews with most of the 30 participants. They seemed, one or two were a little bit reluctant to talk about some of their experiences, but in general, they were very, very keen to put across their experiences, even where there was conflict and abuse. And we had I feel that we didn't really have a great deal of difficulty, which was great.
And found the question again. So I think Eve was specifically talking about shame and not wanting to share a personal business. So I think you've addressed that there. I suppose the one element is you're probably underestimating the amount of efforts that you put into this, Celia, in terms of recruitment, and probably the lapse of time has done us well.
Yeah, I think so. Yeah.
But I think one of the aspects that, in terms of what Celia is saying there, also shows that, if there's trust in terms of people understanding the purpose of something like this in terms of research, then that's one aspect. But the other aspect is that people do want to have some sort of opportunity to talk about these sort of issues, and probably do need that sort of additional support that is more professionally orientated in terms of providing some sort of supports for people going through some of these challenges as well. And I guess the other aspect is that you're not necessarily approaching the recruitment from the point of view of trying to identify those who are most excluded. Certainly, we try to look for risk factors, try to identify gatekeepers who could support that. But ultimately, even in terms of black and white on paper, the criteria that you would imagine would sometimes identify these individuals wasn't always the case. So, and those that you would think wouldn't, sometimes did. So it's about maybe taking a slightly more open approach as well to recruitment itself. Okay, so we are coming towards the end. So there's a number of other questions here. So I think one is just about the biggest policy failing. So Celia, if you have a view on that, so what do you think is the biggest policy failing? Now, we would have addressed that a little bit, but towards the end there, but perhaps you can draw out that a little bit more.
Yeah, I think you addressed it, and we addressed in the recommendations, and you in your introduction. I think there needs to be more focus and more consideration given to the social relations and the pathways to exclusion from social relations, and obviously gender as well, and the gender pathways. So I think there needs to be more detail within the policies and how these pathways can create exclusion from social relations, and it just needs to be more explicit, I think, within the policies. over the life course, and obviously into later life for older men and women.
And I suppose just to add to that, then, I mean, if you look at something like the Task Force for Loneliness and so on, and even though we're talking about maybe issues that are slightly more broadly than the specific outcomes regarding loneliness, essentially all of these things need to be well resourced and need to be funded so that, significant programs can be developed and designed in conjunction with the lived experience of people themselves and in consultation with them, but also to have a multifaceted approach to addressing these sorts of issues. And that really does require resourcing, and does require some form of strategic planning as well, much like the Task Force for Loneliness has been advocating and looking for too. Okay, so the final question that we'll take, hopefully, is a reasonably quick one here, Celia, is just around the significance for geographic location. So you could see in some of those quotes there, both the rural and urban element and all the in between. So if you just want to maybe say something about that reasonably briefly.
Yeah, well, I think there was maybe differences in that. I would have maybe thought that people living in rural locations might be more excluded or less likely to participate, but in general, the urban areas, people were, I think, there wasn't much difference, I don't think, between the geographic locations in the experiences that the men and women talked about. There was a mixture. I think, obviously, the rural location, there was the problem with transportation for some of the older people, which would restrict their social participation, rather than unlike the urban, which they would have access to perhaps buses or walk into a social group or something. So I think that was probably the major or main difference.
Yeah, and I think that probably tallies with some of the other work we've done previously, both in urban and rural areas, where I suppose largely people would talk about changes in socialization and the sort of ways in which informal contact has maybe been perceived to be displaced somewhat from daily routines, from just meeting your neighbors and connecting with your neighbors. And that's probably true both of urban and rural areas of different kinds, remote rural areas versus inner city urban versus suburban urban areas. I guess what you might find, and this is not so much in Celia's findings, but just more generally, you might find different tipping points that changes things very quickly for people, whether that is to do with mobility, and that could be obviously in terms of physical mobility, and that would apply probably equally to urban and rural, unless you're right in the heart of a community. But also then the transport issue, particularly around ceasing driving. So I think people did talk about that reliance on driving, which we all very much know and understand as well. And then on the other side, there is different life stages that we're at, where we might require different kinds of relationships, different kinds of dynamics at different points. And that's certainly true at different points in later life as well. Okay, and before I continue on in that, I think we have come towards the end of our session, and on that basis, I think we'll do well just to close out our session. So all that reminds for me to do is just to thank you all for attending today's event, and please do have a look at that policy brief on our website, and please do send us any additional questions that you might have offline, and we'll be happy to address them. So thank you very much. Bye-bye.
Thank you.